can you briefly explain what the ACA is and what problem is it trying to solve?
So the ACA is actually a law. It's the Affordable Care Act, which is a law that allows consumers like me to get access to commercial health plans outside of an employer. And the law gives us some subsidies based off of income. So the law, first of all, doesn't allow you to ask any health questions other than smoking, right? So they're not allowed to say, hey, Joanna, you've had a hit in the chest and you have sleep apnea, you're gonna get denied. They're not allowed to ask that, right? So pre-existing conditions don't exist on ACA, which is important because Rusty, when I worked at Social Security, guess what? I served so many people who came in and said, Joanna, I just lost my job because I have this illness or this injury. I need to file for Social Security disability. But what am I supposed to do for health insurance in the meantime? Because Medicare has a 24-month wait. I have stage 4 cancer. How am I supposed to get health insurance, right? And so before Marketplace, before Obamacare, the Affordable Care Act, it was really hard. I'm like, you're either gonna financially qualify for Medicaid or you're gonna be up a creek unless you have something like a spouse that has a plan that you can get on. I don't have a spouse with a group plan to get on, right? Like I'm a disabled veteran and I still wrote myself a Marketplace plan because the VA can't solve my needs either. So the ACA is simply a law that allows commercial products to sell direct to consumer, like you and me, and no pre-existing conditions. And then we also qualify, some people qualify for tax subsidies based off their household composition and income.